great guy over here. Really. Move on this way.
Pakulan niya na yan eh.
All right, we're going to get started here because this is kind of a long, dull, boring in-service. Okay? All right, today we're talking about risk management. What is risk management? Y'all know what it is? No. Basically, that's right, managing all risk. So, risk management is defined as a systematic process of identifying, evaluating, and addressing the potential and actual risk. It relates to healthcare. It aims to help us provide the highest standard of care in a safe environment. Okay? Risk management evolved in the 1970s when we had this big medical malpractice surge of claims. And because of the increase in claims, they wanted to find out what was going on, what could they do about it, how could they fix the problem. Okay? So one of the problems that it was causing was the soaring cost of the hospital. You know how when you go in there now and you pay $6 for a Tylenol? Right? That's part of why things are so high. Okay? Historically, risk management and quality improvement were separate things. Okay? And they didn't share and they didn't overlap their information. And a lot of times what would happen is something that would be considered a risk management problem was also a quality improvement problem. And they might have been working on the same project, but they weren't sharing information. So about 10 to 15 years ago, they kind of integrated together. Okay. Resident safety, it was the utmost of importance as it is today. And the focus is more proactive and less reactive. We want to fix things so that they don't happen again, right? Analysis is done. It's a root cause analysis. We're looking to find out what the problem is. And we involve all team members, as many team members as we can when we're trying to resolve a problem, okay? There are 4 primary functions to today's risk management programs, and the focus has shifted from individual fault to identification and improvement of dysfunctional systems. Okay, okay, so what are the functions of a risk management program? Anybody know? Y'all are very quiet there. Provision of high quality, safe resident care, risk identification and evaluation, loss prevention, and resident safety. And along with that comes education. Okay? Today we want to lost my train of thought. Okay. It's commonly accepted that one person's action is rarely the cause of an incident or an accident. Okay? Rather, a pre-existing organizational issue that lends themselves to departure from safe practice, causing untold events. Okay? How does risk management work? Do y'all know what we do when we're doing a risk management evaluation? No? Okay, so risk identification through observation, experience, and internal reporting process. We do a risk analysis. We evaluate on systems and processes, not people. We evaluate risk intentions and interventions and implement appropriate changes to prevent further risk. What does quality improvement do? Its core measures focuses on national initiatives. It identifies areas and opportunities for improvement, analyzes outcomes and efforts to improve systems, and quality indicators. I know you all have heard us talk about quality indicators. Okay? So what are the functions of risk management and QI together? It depends on the size of a facility, how many of these that a facility will have. Here, our risk management is all encompassed basically into one thing. Risk management function is to adverse event reporting, loss prevention, corporate compliance, resident safety, risk identification and evaluation, and education. There's some overlapping functions between risk management and QI, and those are analysis of adverse events, resident safety initiatives, staff education, and root cause analysis. I know you all have heard root cause analysis. Okay? What are QI functions? They're the core measures, the benchmarking, QA projects, resident satisfaction, and process improvement. So y'all can't tell me y'all haven't heard them words before, because they get preached around here a lot. Okay? So what's your role in risk management? Anybody know?
Making sure the patients are safe.
That's right. Risk management requires full participation of every employee. Therefore, it is critical that every employee be educated about risk management and your role. Okay? It is your obligation to report all variances and incidents experienced or observed. Okay? So if you see something that doesn't look right, you should be talking to a supervisor. If you see something that might be a potential hazard, you need to speak up and say something to somebody. Okay? Risk management fails to succeed with 0% variance reporting, but it succeeds when we have 100% involvement. Okay? So you're asking, what's a variance? Anybody know what a variance is? It's a variety. Okay. A variance or an incident is anything that deviates from your scope of practice or standard of practice. Okay? So that would be med errors, a missed order, a fall, whether it's a resident, an employee, or a visitor. Inaccurate or incomplete documentation. So if you didn't do your charting today, you've created a variance. Okay? Resident complaints and any experienced and or observed breaks or problems with a process. So it doesn't necessarily have to be an actual incident. It can be something that's a potential problem. Okay? An adverse event outcome does not need to occur to qualify as a variance. All variances need to be reported. Okay? 100% reporting allows us to make necessary changes for any negative impact. Okay? If you get hurt on the job, you need to report it. Okay? You may not want anything done about it right now, but 2 days from now, when something comes up and you're having problems, you didn't report it. What are you going to do about it? Come in and do a late entry? That gives workers' comp an opportunity to say, no, it didn't happen at work, so we're not paying for it. But if you report it and something does happen, it doesn't make any difference. We will take care of it. Okay? Let me see here. Some facts about variances: an adverse outcome does not need to occur. All variances, like I said, have to be reported. We have 100% reporting, and we track all of the variances. Okay? And we have electronic reporting system. You know what TELS is? Okay? So that's for your environmental problems. You also have the residence incident report that's in PCC. Okay? There are forms that you fill out if there is a visitor or an employee incident. We track all of those things. Okay? Once you submit a variance, then it has to be reviewed by a manager or a supervisor or the risk manager. Y'all know who the risk manager is? So if you have any questions or concerns about anything, go see your supervisor or come see me. Okay? Here's some kind of key concepts for you. Regardless of the model used to analyze an incident, there are some common key concepts. Analysis of event may find one individual requires further education, or it may find that a problem is generalized, indicating a need for a process or system change. Okay? Institutional or organizational problems are things like conflicting policies, lack of management knowledge of risk reduction, high workloads and insufficient staffing. Case management problems identify care management problems or actions or omissions of an element in the process of care, like incorrect medication administration, failure to notify a physician when indicated, failure to properly monitor a resident, failure to report important information change of shift, okay? So if there are things going on with your patient, you need to make sure that you pass it on in your report, okay? Another thing would be change of condition forms. If there's something going on with your patient, you need to do a change of condition form, okay? And that doesn't mean that just nursing can do that. Anybody can start a change of condition form. Therapy can, nursing can, PTOT, all of those people. Housekeeping and maintenance, you need to be talking to the nurse and let her take care of that for you, okay? Significant clinical events. Many events are things like hypotension, bleeding, an allergic reaction to something. Resident factors can be a resident exhibits distress, a resident is anxious, a resident is not coherent, or the resident speaks in a different language. Those are all problems that need to be addressed so that the resident doesn't experience any further problems, okay? Staff factors can be lack of skill or knowledge to perform a certain skill, lack of knowledge regarding interpretation of assessment data, okay? So that means when you're reading lab results and you're not sure, you need to pick up that phone and call the doctor, okay? Team or contributing factors, identify other team or contributing factors such as poor communication. Okay, does everybody know what root cause analysis is? Okay, root cause analysis is a tool that we use to perform a comprehensive review of incidents, okay? It has three primary goals, and that's to determine what happened, why it happened, and what can be done to reduce the likelihood of it happening again, okay? There are a series of steps that we use to conduct a root cause analysis, and Debbie may ask you guys to assist doing some of these because we try to utilize the staff as much as possible for these things. Okay, so to determine if an adverse incident occurred, we have to define the problem, we have to determine what happened, and we have to determine what the specific symptoms are. So it doesn't have to be a mechanical thing, it could be a patient that needs a change of condition form done, okay? We then compose a team for evaluation, and this team is usually multidisciplinary, and we seek to develop a culture of safety, okay? We include experts who are familiar with the situation, and then there should be maybe a doctor, nursing staff, pharmacy, administration, maybe somebody from therapy. There's a whole team that gets together to do this. Usually most of our adverse incidences we review in morning meeting because we have a whole team there, okay? The process to conduct it, review the steps of the process with the team, develop team member roles. We review medical records, policies, procedure, maintenance logs, site inspections, and staff interviews. So when something happens and I come up and I ask you to write me a statement, that's what I'm doing. Other things, we try to identify as many causal problems as possible, and we don't stop at the most obvious cause. We want to dig a little bit deeper to make sure that there's nothing way down underneath that we're missing. Okay? We develop an action plan. We review the literature for evidence-based references. We determine how that plan is going to be executed. We assign responsibility to a specific person, and we define completion dates and determine how the plan will be monitored. When we got ready to do the gold award, you guys did not see all of the things that the team, the big team, had to put together. There were a lot of steps in us reaching that gold award. But we divided it out between the team members so that we could conquer each thing quickly and efficiently. And obviously we did a really good job because we got the gold award. And the thing about that is we got the gold award without having to do a second try. Most places get a site visit, but they don't get the award. And then they got to start that whole process all over again. Okay? We were lucky. We did the process, we had the site visit, and we got the award. Thank goodness. Okay? Okay, then you have to measure the effectiveness of your plan. So you're going to conduct planned monitoring changes. So when we're doing audits and things like that, that's what we're doing. We're monitoring our changes. And we have to determine if the processes are embedded into routine staff behavior. Okay? Then we have communication, where we're trying to get your feedback on things that we've done. Communication methods like staff meetings, TGIAF, all of those fun things. Right? Is that boring enough for you? I'm going to bore you even more because there's a test you get to take. If you want to start passing those around, we'll do this and we'll get it over with real quick. There was a case study I was going to do with you guys, but I figured I'm not going to drive you that crazy. So everybody take a paper, pass it around, make sure that you put your name and today's date on there, and we'll go over the test together.
Oh, there's only 3 of me.
You guys got enough of that?
It's down that way.
Who has the sign-in sheet, by the way? That's got it over there. Now, the nice thing about being here today is you get credit for this in Healthcare Academy. I will put it in for you so that you get credit for it, because this is one of those mandatory in-services that you have to have every year. And I see I do have a few nurses here. Next Thursday, the 12th, there will be a mandatory nurses meeting. Yes, a mandatory nurses meeting. There'll be one at 7:30 in the morning and one at 2:30 in the afternoon. Okay, does everybody have a test? Are there any more blank ones around here anywhere? Okay. Anybody else need a test? All right. Question number 1 says the goals of root cause analysis include determine what happened, determine why it happened, determine what can be done to risk the likelihood of reoccurrence, or all of the above. All of the above. Okay. The next question is, root cause analysis is a tool that can be used to perform a brief review of incidents. True or false?
True.
It's false. Next one. To report a variance, An adverse outcome must occur. True or false? False. Next one, quality improvement and risk management have become unified in their approach toward high-quality resident care. True. Okay, next one, what is a variance? Fall, medication error, missed order, it's all of the above. And last but not least, risk management in your organization aims at D, all of the above. Please make sure that your name is on your test, and you can drop it off at